Good evening. My name is Jonathan Brister, and my topic for today is mental health resources in schools, challenges, models, and impact. Did you know that nearly 1 in 5 public school students use school-based mental health services? Mental health among young people has become a crisis. Schools are a key place to help. School-based mental health resources are crucial in providing accessible care to students, but there are significant challenges in funding, staffing, and execution. Effective models exist, and expanding them can improve youth well-being. My points for today are the current landscape and need for mental health services in schools, key barriers to effective implementation, effective models and proposed improvements, impact and outcomes of school-based mental health resources. Current landscape and need. According to KFF, about 18% of public school students utilize school-based mental health services in the year of 2024 through 2025. Nearly 97% of those students provide at least one type of mental health service. Many students do not have access to mental health providers outside of school. School settings can reduce barriers, costs, transportation, and stigma. Point 2. Barriers and challenges. Sometimes staffing and funding shortages. According to NCES data, more than half of public schools report not enough staff or funding to provide effective mental health services. Provider shortage. Many schools struggle to employ licensed mental health professionals. Policy practice gap. There is sometimes a disconnect between mental health policy frameworks like MTSS and how they are actually implemented in schools. Point 3. Effective models and proposed improvements. Comprehensive School Mental Health Model, research by Renicky et al., describes a decade-long development of a school-based mental health system that integrates prevention, early intervention, and treatment. Optimized interventions. The National Institution of Mental Health is calling for more research into culturally responsive, evidence-based school interventions. Policy recommendations from McKinsey. 6 actions for states and districts, such as building sustainable funding, developing community partnerships, and growing the mental health workforce. Impact and outcomes. Positive outcomes studies how that when students have access to school-based mental health services, they are less likely to report having attempted suicide. School-based mental health resources are vital but under strain with the right models and policy support. They can significantly improve student well-being. It matters because by investing and improving these services, schools can become a frontline in supporting youth mental health, especially for students who might otherwise not receive help. I have previews, visual aid previews from my phone, and it says priorities for enhancing school mental health services for children and youth. The American Academy of Pediatrics declared a state of emergency for child and adolescent mental health in 2021. Over the past decade, Black youth suicide rates have increased faster than any other racial or ethnic group. To enhance school mental health services for all children and youth, we must refine and improve the school and community infrastructure for mental health services, provide greater and improved interventions for anxiety, amplify Tier 1 supports for address growing mental health needs and prevent severe illness, elevate teacher, student, and parent caregiver voices. To enhance school mental health services for children and youth who are racialized, we must reduce barriers to service by increasing cultural match between providers and clients, addressing high cost and increasing the number of providers, shift the school's culture toward inclusions, beginning with meaningful professional development for all school administration and staff, create interventions that explicitly connect racial identity and mental health, including intersecting identities such as race and gender, and eliminate discipline policies, procedures, and practices that are punitive rather than supportive. And I have another one. It says the 5 T's for mental health education in schools. Talking about mental health. Students need open and ongoing conversations to help decrease the stigma surrounding mental health. The earlier these conversations start, the better. Since around 50% of all mental health illness begins before the age of 14, and many cases go undetected and untreated, school-wide strategies to increase awareness, such as providing mental health and well-being tips. Training. Educators need training to appropriately identify and respond to signs of mental health issues. Teachers are often the first adults that students turn to in times of distress or crisis. Teaching. Mental health education can be integrated into academics and classwork in a way that doesn't overly burden teachers. Tools. School counselors play a central role in providing direct services to the students in need and taking care of teachers. In addition to addressing students' mental health needs, school also needs to make sure to support educators' mental health needs. Thank you.